So, good evening, everybody. Thank you so much for joining us. My name is Jade Adelbert. I'm the Director of Prevention Programs at Durham Middlefield Youth and Family Services. I recognize I'm saying that to a room full of people who I've met before, but that's okay. Today, we have an amazing opportunity to hear from Monte Nido Walden, from both Brooke Lombardo, who is I'll read a little bit about her bio. She's an amazing clinician who is the program director there, as well as David Sadowski, who is part of the outreach team. So I'm going to, before I go in and read the bio for Brooke, I do want to say that this is our parent and adult education version of the same presentation that Brooke presented to the high school on a few days ago on Monday. And we were talking before we let everybody in that the high school students were really engaged throughout the entire presentation and had a lot to say afterwards, like most positive. So we are very excited to hear the adult version now. So without further ado, I'm going to just say that just go into the bio. So Brooke has worked in the mental health field for over 10 years and brings a holistic, individualized approach to the care she provides. She began her journey with Monte Nido Walden as an adult clinician when the Guilford Clinic opened in 2016, supporting individuals through PHP, partial hospitalization, and IOP, or intensive outpatient levels of care. In 2024, she returned to Monte Nido Walden as the program director in Middletown. She was drawn back by the compassion and dedication of the staff and her deep passion for supporting all individuals affected by eating disorders. Brooke understands how challenging and vulnerable it can feel to seek help, and she has spent her career making sure that people feel safe, supported, and empowered in that process. So we are incredibly grateful to have her here today to share her expertise and guide us through this important conversation. So I'm going to pass it over to Brooke. Thank you.
Thank you so much, Jade. Can everyone still see my screen? Because I don't have the green line anymore.
Yes.
Yes. Okay. Perfect. I'm guessing, Jade, you might have to change the slides for me. I don't know if I have the ability, but I can try. Um, so I know we have a small group, and I certainly want to make sure I leave time for questions and answers. And if there's something that I'm talking about that somebody really just has a question they want to kind of talk about in that moment, please feel free to just hop off mute and we can have a little dialogue about it. I'll also leave some time at the end for questions. But I'm really, really excited to be here. It was really, really fun to join the high school on Monday. And like Jade said, the presentation I'm sharing with you, some of that information I shared with the students, and then some of it not as much. I kind of also focused a lot with them on social media and the pressures kind of to fit in. And we talked a little bit about comparing ourselves to others, which I probably won't talk about as much here, but more so a little background around disordered eating and eating disorders, and then also a little bit of information on how to support or help, and then what that can look like in different kind of levels of care. So I'm gonna try. Jade, I might need you to. Oh wait, I think I can do it. You can see the next slide. Dave, okay, perfect. All right. So I want to start with just laying some of the foundation of the prevalence of eating disorders, and how sort of pervasive this really is. And, I don't know everyone's background on the call, but I think sometimes when we think about eating disorders, sometimes people maybe they know somebody who's experienced it or struggles with it. However, it's a lot more prevalent than I think people really understand or realize. So one of the big things that I did share with the students that I think it sounds like, and some of the teachers maybe even were really surprised to hear a statistic that 81% of 10-year-old children are afraid of being fat. And I think, when you think about that, right, that doesn't imply that, 81% of children will then, grow up or develop into an eating disorder necessarily. But I think it just speaks to our culture and our society and the messaging that we receive at a very young age around people in larger bodies or, like fat phobia, and that there's this very large portion of 10-year-old children. We're talking about, right, 10 years old. What's that? Maybe some of my people on the call, it's got to be like middle school, if not maybe even fifth grade, right? That's pretty young, having this fear of being fat. We talk a lot, or we work with a lot of people who maybe, their adolescence, they went to a pediatrician appointment for their annual, and there was a comment maybe made about their body changing or where they're on the growth chart, right? And this sort of shame that comes with that, or this feeling of not being enough or of being valued in a different way based on that. So I think that just again speaks to that is a piece that can then potentially put someone being more vulnerable to developing an eating disorder in their life or having disordered eating, which can be just as dangerous. The other one that I always like to point out to people is that 35% of adolescent girls engage in crash dieting, right? So we think about like diet pills, intermittent fasting, laxative use, things that potentially and generally can have really detrimental outcomes if misused over a period of time. Again, doesn't mean that everyone who goes on a diet is necessarily going to then take that to a place where it becomes disordered eating or an eating disorder. However, it still can be really impactful for an individual in that kind of having that kind of experience. Um, and the other one that I really like to point out, because I think when we think of eating disorders, in society and culture, we often lean towards thinking about women or girls developing eating disorders, when in fact, one in three individuals who develop an eating disorder end up being male. So I think it just goes to show, right, there's still that, I mean, there's stigma in general, right? But there's a lot of stigma or misunderstandings around adolescent boys or men who experience eating disorders. And oftentimes it sort of presents or looks very different. There might be the standard typical person trying to sort of change their body and make themselves smaller, but oftentimes we'll see with boys and men the sort of like idea of bulking up, or utilizing different types of diets to gain muscle, and in fact do it in a way that can be really detrimental to their physical health, whether that's using some form of like a steroid or a supplement, or even just a particular diet that doesn't allow for all food groups. So I think that's something to also be aware of, right? We think of it in the sense of people just sort of focusing on making themselves smaller, not always necessarily the case, and usually presents very different in boys and men. And there's some other statistics on here too. I think the other one I like to sometimes drive home that I didn't necessarily share with the students, but I think it's important to kind of share here, is that eating disorders are the second deadliest mental health disorder there is. The only mental health disorder that ends up killing more people is the opioid epidemic, that probably everyone on this call is familiar with. I this is the point where I usually ask the question, and it's more just something to think about. Like, I imagine most people on this call haven't really thought about hearing like somebody passes away as a result of their eating disorder, right? It's not usually what you hear in the news, or from a family friend, when sometimes we do hear that people die of overdoses, right? It's very much out there and people are talking about it. Because what generally happens for somebody with an eating disorder or disordered eating is that the medical complications that come along with eating disorder are ultimately the reason that someone could potentially pass away, going to sleep, not waking up. There's a lot of complications that can happen with our metabolic system, our electrolytes, our heart, that then cause so much pressure that people do end up passing away. So it is also incredibly dangerous in a lot of ways. Okay. So I also like to spend a little bit of time. I always think it's really important where we think about myths when we think about different mental health disorders, and I like to focus on the truths about eating disorders. The first one probably, I mean, they're all important, but I think the first one I always like to drive home, that Oftentimes, many people who maybe are experiencing an eating disorder or disordered eating or in sort of like the diet culture and may look incredibly, so quote unquote, healthy, or be in a body, a larger body, but are actually incredibly ill. Again, we think of social media and we think of movies or we think of even, famous people, and oftentimes what's portrayed is a very particular vision of what it means to be sort of unwell or sick with an eating disorder, when most people who are in our higher levels of care, who are receiving treatment, who are incredibly malnourished and have the same potential dangers that somebody would in a smaller body, actually are in a quote unquote sort of normal sized body. So I think it's important to know that we can't just look at somebody and by looking at them, define whether they might be having a hard time or struggling or not. Families. So this is where, right, all of you come in and individuals working with, family members who maybe are having a hard time. We want to be really mindful, and it's really important to not sort of point the finger at one person or another on why maybe an eating disorder developed, or feelings around body image or disordered food. We really try to think about it as a way to make them allies, right? Like when we're working with someone and we think about sort of the idea of an eating disorder, food is something that we can't avoid, right? Like, I mean, people certainly try to avoid it, but the reality is, like, we all are eating throughout the day. We are, our celebrations, right? We think about if anyone celebrated Thanksgiving recently, right? Like, that is a holiday that is celebrated around food. A lot of people's cultures are celebrated around food. So when somebody is having a really hard time, being present with food or engaging in food or, obsessing about their body, it doesn't just necessarily impact them. It also really can impact the whole family dynamic, the loved ones around that person. So we also really want to make sure that families are allies in treatment and support. And it can be really disruptive to the entire family as well. Another big one, right? Eating disorders are not a choice. I think sometimes there's a lot of misconceptions out there that people choose to have an eating disorder. Oftentimes we hear experiences from people who maybe their intent was to go on a diet for weight loss, right? Maybe there was a provider that told them to do that. That happens a lot. And then, the perfect storm happens, and that actually turns very quickly into something a lot more detrimental. So, it's not necessarily a choice to have an eating disorder, and it's not something that is fun. It's not something that people really enjoy. It really disrupts everything. Eating disorders don't discriminate, right? So eating disorders are something that impact all individuals, all genders, all races, all ethnicities, all body shapes, all socioeconomic statuses. So that's another really big thing that we try to drive home, right? Again, tends to be sort of identified as like this white woman disease, when in fact, most of the people we serve don't look like that. There's people that are in all different types of bodies, cultures, backgrounds who experience and develop eating disorders. Um, this is one that I didn't necessarily highlight for the students, but it's important to think about here is oftentimes people with eating disorders carry a higher risk of, potential suicidal thoughts or suicide attempts or medical complications. And we'll talk a little bit more about medical complications, but you think about what food really does for us, right? And it's fuel. It helps us have energy throughout the day. And I always use this example, and again, not to sort of minimize what people experience, but to sort of help people understand, if you've had a day where you were really busy and maybe there was a couple hours where you ended up forgetting to eat, and quickly we can become hangry, right? Or we can become irritable as a result of not providing ourselves enough nutrition. And if somebody does that over a long period of time, it can develop into symptoms related to mood, depression, and it can impact somebody's mood to the point where the thoughts are really strong and they're thinking more about suicide. So that is something that we always talk about. The malnourished brain impacts our mood. So sometimes, proper nutrition over time and that support can actually alleviate some of those other symptoms that some of our clients experience. Um, you know, when you think about how an eating disorder develops, or when we talk to families, they want to kind of know the why. And sometimes it can be really helpful, and sometimes it's sort of not where we need to start. But I think, it becomes sort of this like perfect storm of biology and environment and what people are exposed to, that kind of creates potentially somebody developing an eating disorder. So it's not one thing over another, it's usually sort of a combination. Um, we always say, though, right, with an eating disorder, full recovery is absolutely possible, and something that we've seen many times in our work. And we always really talk about the importance of early intervention. So, again, another thing like we really talk to the students about, right? Like, it could be support in if you're struggling can look like a lot of different things, and like the importance of the earlier you try to get that support, the more success you will have in recovery. So we really kind of drive that point home as well. I'm not going to spend too much time on this slide. I want to leave time at the end for questions and answers, but what is an eating disorder, right? This is more talking about, I wanted to talk to you guys and spend more time on like what does support look like? Doesn't necessarily have to be a full-blown eating disorder, but there's a lot of different types of eating disorders out there. So if people aren't super familiar, right? Oftentimes when people think of eating disorders, the first go to, again, partially because of media and just what we understand, unless you've been impacted by this maybe personally, is anorexia, right? Sort of this like true sort of like restriction, fear of gaining weight. Sometimes there's solely just restriction of food intake, calorie counting, obsessing. Sometimes we'll see people who really focus on like clean eating to the point where it becomes incredibly detrimental. They're not getting enough nutrition, over exercise. We have clients that misuse laxatives and diuretics, anything to sort of try to manipulate their weight and have a real fear of gaining weight. And as a result, there's a lot of medical complications that often come. Bulimia nervosa is similar, right? But there tends to be these cycles. So then there's also this component of binge eating disorder or binging, when somebody goes kind of the pendulum, and to sort of solely just restrict without some form of binge eating is very rare, because our mind will continue to think about food and need food. It's trying to survive. So that's oftentimes when people might experience a binging episode, followed by some sort of compensatory behavior, right? Again, restriction, overexercise, self-induced vomiting, some sort of release or compensation for the binging. Then we have binge eating disorder, which is not necessarily newer in the sense of a disorder that people have experienced for many, many years, but as far as in the DSM and what's sort of been classified, and that's sort of these episodes of binging that don't have any or other sort of compensatory behavior. The one that I kind of want to spend just a little bit more time on, or just sort of highlight, is this disorder called ARFID. And when I asked the students on Monday, like, had anyone heard of that, like by a show of hands? And there was 300 or so of them in the room. But there was quite a few people that raised their hands. So while maybe they know somebody or they've heard the term, like, the students are certainly educated or getting information right somewhere, whether that's on the internet or from their friends. But ARFID is something that, again, is something that a lot of people have experienced for a really long time, but maybe wasn't really ever kind of identified or sort of concrete in the sense. And it's similar to maybe anorexia in the sense that it's a very restrictive eating disorder, but oftentimes people who are diagnosed with ARFID are restricting food intake for something other than the fear of weight gain. And oftentimes we'll hear from our ARFID clients that they actually want to gain weight, they're struggling to gain weight, they recognize that as a problem, but the reason that they're avoiding food is for some other reason. A lot of times it can be due to texture issues, right? So we work with people who maybe are on the autism spectrum or neurodivergent, and they're avoiding certain food groups due to like texture issues. So they're really sort of sticking to some pretty rigid foods. If there's a lack of interest in food, right? Just the like idea and the struggles around being able to eat consistently. There's the fear of getting sick. Sometimes we'll have clients, and this happens a lot with our adolescents in our program, our younger kids. They might be so afraid they're going to get sick from the food. They feel like it's contaminated, or maybe they once got sick off their food, had food poisoning, and now they're like, anytime I eat, I'm going to throw up and I don't want to throw up. So they're really fearful and just completely want to avoid food altogether. Oftentimes these are the kids that maybe grew up when they were little and were like the picky eaters and then never really just grew out of that. So maybe there's only very few foods that they'll actually eat. Otherwise, they're not getting the proper nutrition. So then we have the work to kind of support them, and the treatment might look slightly different for somebody with RFID. But that is certainly something that we see a lot, and we see a lot with our adolescents. And then we have OSFED. Again, this is sort of when we think about people, right? No, most people don't fit in a box, and other specified feeding and eating disorder really kind of allows us to treat people who maybe like don't necessarily fit some of the criteria, but like are still using behaviors or restricting or, intermittent fasting in this way that like they're not getting proper nutrition and they really truly need the support to kind of get more structure around food. So they're not, again, fitting in one of these other boxes, but certainly most of our clients land in this category. And it can still be really dangerous for an individual if they're not being properly nourished or using particular behaviors as a result, right? If you think about some of our clients struggle with self-induced vomiting, but they're not necessarily binging, so they don't really fit in bulimia. They may just have that other piece, which can be really, really dangerous. All right. So I've kind of shared this with the facts slide, but we really like to sort of drive home that anyone can be impacted by an eating disorder. 50% of the BIPOC individuals with eating disorders oftentimes are half as likely to be diagnosed or receive treatment, right? And we serve people in all populations, and oftentimes we're trying to really focus on how to make sure that our treatment and our support and our access to care is equitable to all individuals. And oftentimes in certain cultures, maybe mental health is just not looked at differently, or they're not aware, or the presentation looks really different. So people get misdiagnosed or missed when in fact they're really having a hard time. We often see a lot of clients in the LGBTQ community who particularly struggle with disordered eating and eating disorders. That can be for a lot of different reasons. With some people in that community, culture in the community, in the queer community is very, can have these pressures of wanting to sort of change the way we appear or look. There's also people who struggle with their identity and gender, and as a result, if they're maybe not getting the most affirming care, they may be trying their best through manipulating food to try to change their body so it doesn't develop in one way or another. So we've seen that as well a lot in that community. But again, just driving the point home that anyone can really experience an eating disorder. Okay. Again, what causes an eating disorder? I talked a little bit about this, but we often think of it as like the perfect storm, right? So the medical, sometimes people have just, other sort of medical conditions that they maybe have always struggled with that it kind of maybe could potentially put them at higher risk. The example's not here, but I always bring this up because I think it's an important one to think about. Someone who maybe was diagnosed with type 1 diabetes as a child, that can be a really traumatic medical diagnosis, right? And it impacts the rest of your life. You have to be very conscious and aware of your carbohydrate intake so that you can make sure that you're giving your body what it needs to break it down. And that could naturally, right, if you're so focused on those numbers for somebody along with, some social environment and some psychological could impact and develop into an eating disorder as a result. Our environment, what we're being, what our family sort of talks about around food and bodies and growing up, our peers. I talk to the students a lot about social media and what we're hearing about influencers, what's being sort of said to us or, fed to us, for lack of a better word, in a way that kind of creates these beliefs that adolescents can be really impacted by. And then just our psychological, right? Like just our natural makeup as people, some people are more highly sensitive, some people maybe are more anxious, and there's these different things that we have as characteristics. And again, that perfect storm for some of our clients is what creates or develops the disordered eating. Usually doesn't happen overnight. So this is just one of the slides I shared with the students about social media, and I wanted to keep it in this presentation because while maybe some people here on social media, I just think I think everyone mostly is on social media, different platforms maybe, but I think it's important to know this, especially if your children are on different platforms, right? There are, pro eating disorder communities out there. So if you have an adolescent who's seeking maybe ideas or tips and tricks on how to lose weight or engage in very dangerous behaviors. That is on the internet, and we really try to challenge and work with our clients to support them to not access those resources. Sometimes if you Google certain things on the internet, around sort of trying to change or manipulate or, asking about maybe a particular eating disorder behavior, there is sort of this caveat of then oftentimes a resource will pop up that'll say, are you struggling with an eating disorder? Here's a hotline, here's support. So the internet, I think, tries its best to stop from, people accessing that information, but it is out there. Um, these unrealistic standards, right? We talked a lot about that with the students on Monday, right? Like, there's this expectation that's set by influencers, by, stars, by famous people that isn't reality and isn't how any of us actually, look or go about our day. And people can be impacted by that in a way that could create these harmful norms that they engage in. Fitness trends, right? There's a lot of people on the internet who are offering fitness trends, exercises to do, what they eat in a day, right? And most of the time, they're not actually have the education to be providing that information. Maybe they're an influencer, right? They're getting paid to push a product. So there's a lot of misinformation that's being spread. And then also there's just like some very potentially activating or triggering images and content on social media. So we talked a little bit with the students about, ways to kind of combat that. And I gave them resources of different, social media platforms they could follow instead. But just trying to kind of go through our feed and sort of detox and unfollow different accounts that maybe aren't serving them because that could, we're just scrolling and what we're kind of seeing, even if we're not stopping, is going through our mind and it's going to impact us. All right, so I want to spend a little bit of time talking about like what to recognize, how to support someone. Maybe you're on this call because there's someone in your life maybe you're worried about, maybe you're just curious. But this is just always helpful kind of information regardless of your role or who you are. When you're worried about someone, some of the things that could potentially be signs that someone's sort of engaging in disordered eating or a relationship with the food or their body that's not necessarily healthy or could be detrimental to them. One of the signs that we see with some of our clients is what we call microbiting. So when you think about taking a bite of food, right, what would be like a normal bite of food, you have a bite of a sandwich, right? You take the bite. Sometimes our clients will take very, very small bites so that sort of it essentially appears that they're eating, but they're taking a very long time, right? Their pace is really slow. The amount that they're taking in at one point is not sort of what you would imagine is like a typical bite. People push food around on the plate, right? We break up our food, push it around the plate. You might break up bread. Some people, this might just be something you do, like it's just a preference, but oftentimes it can also be a way for somebody to try to appear like they're eating food or that something has come off the plate when in fact they're just trying to like push it around the plate. If people are hiding wrappers, right? Like they're trying to not let people see the food they're eating. There's oftentimes eating disorders come with a lot of shame, and people are afraid. There's some stigma around it. So they're trying to hide what they've eaten for fear of judgment. Um, Sometimes we have people eating in a particular order, right? That might be, again, a preference. And we try to like break down what's a preference versus what's potentially something that's part of an eating disorder. But eating certain foods first so that you maybe get the foods that you feel more comfortable with or safer, and then being hungry or being full, where then you don't have to touch the foods that maybe are a little bit more scary or harder for you to have. Um, Food pacing, I kind of talked a little bit about this. Sometimes, and what does it mean? Like a food pacing, some of our clients will eat food very, very quickly. Sometimes our clients will eat food very, very slowly, right? Like trying to get them to a pace that's more normal. So that, oftentimes clients eat food really quickly. One, it could be because they're not providing themselves enough nutrition, so they're really hungry. Or it could be the discomfort of having food in front of them that they want to sort of eat it as quick as they can so that they don't have to sit with it or see it in front of them. Eating slower, kind of trying to avoid having to eat it all, slowing down that process. When we think about body image and we think about people struggling with feeling comfortable in their body, they might be wearing baggier clothes, right? Of course, it's winter time, so people are in layers. So this time of year maybe feels a little bit more comfortable for people. But, is it the middle of summer and they're wearing really, a sweatshirt and baggy clothes, even though it's really hot outside? Or are they, wearing clothes that are a few sizes probably larger than they need to for fear of sort of showing their body off, and trying to hide or make themselves kind of disappear a little bit. Um, some of our clients avoid specific food groups for fear of sort of villainizing different food groups because our culture sometimes villainize different food groups. And then sometimes there's inappropriate usage of utensils. So, what this really kind of is, or an example I like to give, right, is we're using a fork and knife for something that maybe isn't necessarily something you would eat with a fork and knife. So, like, the best example I can give is, a sandwich, right? A sandwich is a handheld item. It's meant to be picked up, it's meant to be taken a bite into. And sometimes we'll have clients that foods that they're meant to like pick up and eat, they're not touching and they're using a fork and knife, which has got to be really hard to eat a sandwich with. So that would be an example of like an inappropriate use of utensils. The big things that I always like to drive home, maybe you're asking yourself, is there someone in my life that I am worried about? Is something changing? What's going on? I want to be able to support them. Start asking yourself, and I said this to the students too, right? Maybe they have a friend that they're close to. Is their friend starting to avoid those social gatherings, right? Is the person that was always kind of around and involved, like sort of distancing themselves, avoiding social gatherings? That could be for a lot of reasons, but oftentimes, right, our clients will talk about not going out with their friends or doing different activities because oftentimes activities involved around food, right? You go to the movies to watch a movie. Generally, you get candy and popcorn and soda before a movie. So let's avoid that, right? I don't want to have to like put myself in a position where I'm afraid to like eat any of that food. Or they might, your friends are going over to have pizza and a sleepover and they're uncomfortable with doing that. So, are they starting to avoid these gatherings? Are they becoming more private about their eating habits, their exercise, their routines? They're sort of just like secluding themselves and not really engaging in talking about those things or being maybe a little bit more secretive about it. Has their mood shifted? I talked a little bit about this already, right? Like malnutrition or inappropriate food intake and inconsistent intake can impact our mood. So has someone become more irritable? Have they become more depressed? Or has there been a shift in their mood? And again, I recognize there could be a lot of reasons for that. It's not necessarily food related, but malnutrition absolutely impacts that. So it's something to kind of be aware of. And is it somebody who seems to be really obsessed with their body or weight, right? Are they constantly seeking or asking questions about how they look, or did they gain weight? Did they lose weight? Like kind of fixated and focused on their body. We talk a lot about body checking too, which if you're not in this work, you might be like, what the hell is that? What does that even mean? Right. But maybe they're like constantly touching their body to sort of measure or kind of get an idea of, their body and what's going on, standing in front of mirrors, looking at themselves as they pass a building that has a reflection. Lots of different ways that people tend to body check that can be really detrimental, and can be all consuming for somebody with an eating disorder. Um, I like to also talk a little bit about like the cavemen mentality, right? Just kind of driving home this idea if we're not providing ourselves enough nutrition. At the end of the day, like a lot of people who struggle with this or struggle with disordered eating will talk about, you know, constantly thinking about food or when I'm going to eat next, what I'm going to eat. Like they're always thinking about food or they're always thinking about their body. And naturally, our brain is going to try to survive. And how it's going to try to survive is if it's not getting proper nutrition, it's not going to be able to focus on the schoolwork. It's not going to be able to stay in the present in the conversation with their friends about what's going on, at that weekend, right? They're going to be so focused on the food that it's going to be all consuming because the brain is like, we need to survive, and I'm not sure when we're going to get the next meal. So that obsession is not just necessarily this external thing, it's actually what's happening in our bodies and in our brains as a result of not having proper nutrition. Okay, do's and don'ts. And I recognize it's 6:15, so I want to make sure I leave some time, but this one I think is really important. So the do's and don'ts, when you're talking to people, and I think these are just good reminders in general, when we're trying to support people. But if somebody's struggling, or they're having a hard time, right? When in doubt, validate someone's feelings. When I ask the students, do you know what it means to validate feelings? A lot of them raise their hand. They've heard that, right? But just we don't have to totally understand why something might be hard for someone. But the minute we start to sort of minimize that experience, they don't feel heard, they don't feel understood. So it's okay to just say, like, this must be so hard. I see that you're having a hard time. I'm here. How can I support you? Right? Again, you don't have to know the answer, but being able to recognize that like this maybe is really hard for them, even though you don't understand why it's hard. Like we always hear the term like, well, just eat, right? Just eat more. And that the term just eat sort of implies that it's something that's really simple to do, and why aren't they capable of doing it? So I think just being able to validate how hard this experience can be from someone is really key. And I always say celebrate their accomplishments, right? We focus so much in our society around celebrating when people's bodies change, right? Everyone on this call, I imagine, has heard somebody, or maybe you've been the one to say it. I've been guilty of it, right? Like say like, "Oh, you look so great. You look like you lost weight." Right? And it's such a normal part of our culture. And essentially what we're saying in that moment, we don't know how that person lost that weight. Maybe they're really sick. Maybe they're going through treatment for something. Maybe they have cancer. Maybe they have all these things. Or maybe it's the eating disorder. Even if it is done in a way that was like appropriate, at the end of the day, it's sort of still implying that there's so much value on the way we physically look. When actually, at the end of the day, the things that make us who we are, the things that make us, the things that people remember about us, is all the other things that we do, the accomplishments, how we make people feel, our connections. So when we kind of validate this belief that what we look like and how we appear is important, that's sort of reinforcing all these things that eating disorders really thrive in. Um, so some of the don'ts that I think are important, right? I already sort of said this, right? But like if someone says like I feel really fat or I'm really struggling, I hate the way I look, the don't I think you look fine, right? It's sort of just minimizing what they're experiencing. I know the intention behind that is to make someone feel better, but in fact, generally speaking, it's not super helpful. Again, this you look great. Did you lose or gain weight? Either direction. Again, there's so many other things we can focus on with the people around us. We don't necessarily have to put so much emphasis on people's bodies. The you just need to eat more, the try to cut this out, right? If somebody's like, oh, I'm really trying to lose weight, or like we're not here to give that advice unless you're a registered dietitian and you have the appropriate credentials. Like again, with good intent, sometimes can be really detrimental for somebody. This is a big one, and this is a big one for families that we always really try to drive home. Being really mindful about commenting on your own body. I think this is good in general to do around people, right? Like, let's not make negative comments about our own bodies. I think even if it's not about the person, it still implies that there's this good and bad or this moral around the importance and the way we value people and people's bodies. And the last one, and probably the most important one, is food judgments, right? Moralizing food or good and bad. We all do this. I think everyone on this call is probably can relate to this, but like, oh, I can't eat that. I was bad all day, right? Like implying you ate foods that were quote unquote bad. I can't eat anything else. I have to just eat X, Y, and Z, right? We're putting these moral values on food when all food in reality is nutrition. All food serves a purpose, and all of it can be celebrated. And we really lean into that in the treatment and work we do, and normalizing that and allowing people to then experience food for a lot of different reasons. Okay, so I want to be mindful of time, and I want to give Dave just a few minutes to be able to share a little bit, Dave, really quickly, just about what we do at Monte Nido, in our treatment. So I was just going to go to, maybe I'll stay on the virtual slide. Is that good? And just give you a couple minutes, and then we can talk, see if anyone has questions.
So sure. So my role, and now my dogs start barking. Sorry about that. They were quiet the whole time. So my role is to work with, I'm the outreach manager for Greater New England. And within my role, I work with dietitians, with therapists, with physicians, hospitals around New England to connect them with the best care possible around eating disorders. So we have multiple treatments. So here in the New England area, we have, as Brooke mentioned, we just passed over that slide. We have our Middletown Clinic in Connecticut, which offers partial hospitalization and IOP, intensive outpatient day programs for both adolescents and adults. And that varies. So the PHP is a 5-day-a-week program, and the IOP is a 3-day-a-week program, and all food support is given at that during those sessions. The other programs that we actually have in the New England area is we have a virtual programming. So we have adolescent and adult, PHP and IOP. We have the Free to Be IOP, we have the ARFID IOP, and we have the Rainbow Road PHP and IOP that is dedicated to strictly for the LGBTQIA population, to make them feel safe. It was generated and created to make this population feel safe in an environment that they can talk to their peers and to their colleagues, and it's a wonderful program. We also have within the Monte Nido Walden, New England area, we do have two sites in New England, in Massachusetts. So we have a site similar to Middletown in Westboro, and we also have a site similar to Middletown in Waltham that offer day IOP, PHP treatment programs. The big thing that we do have in New England that, is unique is we have our Dedham Walden inpatient hospital. We have two in the country. We have one in Arizona. I'm not going to be able to pronounce the name. But it is in Arizona. And then we have our adult inpatient hospital in Dedham. And that serves basically patients and clients who are at a point where they are too ill to participate in an outpatient program or a PHP program, and they need to step up in care. We also, along with that, have a residential program, kind of doing this in different order here. But the residential program usually is a step down from our inpatient, where patients still need to be monitored, but they're monitored in a really healthy, holistic, welcoming environment in a house. Usually, it's a beautiful setting. beautiful, each house has a chef that is unique to the house. They have medical monitoring, but it isn't at the level of inpatient where, they're sick and they need to be monitored, basically by a physician, nurse. So it is the step down. So I'm kind of going in a little bit reverse order here. So we have those programs in New England. We also, throughout the Monte Nido system, we have other residential programs I think we are in, last I knew, 29 states. Um, and we have 55 different programs, if I
Yeah.
have that right. And so, you know, what makes Monte Nido unique and different from other programs is we can really offer that continuum and continuity of care. There's a lot of programs out there, and I think every program is great, and I'm not saying anything bad about programs, but there's a lot of strict virtual programs that are kind of making their way into
Mm.
the eating disorder world. And unfortunately, what separates us again is that if we have someone who starts out, say, in a virtual program, and we've recognized that they're not doing well, they're not, succeeding in meeting their goals, we have the capability of stepping them up to either an outpatient, partial hospitalization, or if it gets very bad, we have the inpatient hospital that, it just is a very good way of being able to treat a patient through the various steps of the disease process and getting them towards our ultimate goal of recovery.
Mm. Thanks, Dave. Yeah, and so I know Dave talked about all the levels of care. I think IOP, and we have a lot of relationships with local therapists. So I always think about like other ways, right? If you're wanting to connect, a loved one or someone that you know, and starting out even just talking in therapy, we can be a great resource to help connect you to great eating disorder therapists and group practices in the area or registered dietitians to get that support on the outpatient level too. So that's also just
Right.
important to kind of to note there. I know we only have like about 5 more minutes. I would love to, if anyone has any questions, certainly can answer. I'll keep this additional resources slide. These are a lot of great national resources out there in case anyone is just interested in access to other, information, also virtual meal support for people, that sort of thing. So if anyone has questions, please feel free to hop off. I know I kind of
I,
talked a
I think
lot, so.
I think Martin has a
Oh
question.
yeah, go ahead, Marin.
Uh, Hi, thank you very much for this. And I'm just amazed how much things have changed. Thinking back 25, 30 years ago when good friends of ours had a daughter with a very, very severe eating disorder, and for inpatient treatment had to send her all the way to Tulsa, Oklahoma from
Yeah.
Connecticut in order to go to Children's Medical. My question is on the GLP drugs.
Mm-hmm.
And I was curious, since those are so available,
Yes.
anybody who's, connected with Noom or other things, can acquire them. And so, people have prescriptions also. And I was
Yeah.
wondering that just simply has that entered into the world of disordered eating, people using those for support without any kind of medical association to it, and has that colored things? Has that become a part of things that you're having to deal with as you receive and treat people with disordered eating?
Yeah. I mean, the quick answer is absolutely, Martin. I mean, we see it a lot. You know, and certainly, right, GLP-1s were originally created and are a great tool for people with certain medical conditions, right? And so we might have people that are on them for that reason. Sometimes people come on them for weight loss specifically. So our approach sort of in treatment and the way we kind of look at it is how we can kind of support them outside of that, talk about the pros and cons, right? There is some research on it, but not a lot of long-term research on the impact that it'll have for people. But it certainly impacts people's food intake, and as a result, can be really detrimental to some of the work that we're doing with clients. But it's something that we like work with them on. We're not necessarily saying like, oh, you can't be on this thing if you're in treatment with us, or that sort of thing. We do have free sort of CEUs, and you don't necessarily have to be, and people on the call might be providers or social workers or whatnot. We do on our website, Monte Nido, have great free, like out, they're usually like lunch and learns that are virtual. And our doctor in Miami, and his name is I'm losing his name right now, but he did a whole hour presentation on GLP-1s and eating disorders. And it's very sciencey. And I went to it and I was like taking notes, and like he's very brilliant. So some of it was a little over my head just as far as like understanding it. But it was really interesting to hear sort of the approach of like what GLP-1s are, what the history of them was, and how it's impacting the work and what research is out there. So people are really interested. Those are always available on our website, even after they're initially presented, and they're free. So that one I think was done maybe probably about 6 months ago. So I can even, Jade, I can give you the link to that if you want to share that with this group. Again, you don't have to necessarily be clinical to watch that. I mean, it's interesting. Yeah.
Yeah, thank you so much, Brooke. They are great resources. I go to almost every single one of theirs.
Me too. Hey, you get free CEUs. So if you are a social worker or an LPC or something, they're free. It's an hour free CEU. Yeah. Are there any other questions? Thank you, Martin, for that. That was a great question.
Yeah, this is Denise. Do you have a question? I know, like in the beginning, you were talking about, where some young adults might hear about it right from, pediatrician visits and like the charts and information. So I'm just kind of curious of this like balance, right? Like, and how do you work with, I'll say, the pediatricians and the medical community where they're publishing charts about saying like this is your point of like you've crossed a point that's not good for you, but yet you guys are trying to say like wait, right? Like, we don't want to go too far one way. So how do we do that balance?
Yeah, it's a great question, Denise. So, we try to spend a lot of time in the community, Dave, absolutely, myself when we can, and we'll go to pediatrician's office and try to provide that education and understanding, right? We talk a lot about, and our dietitians and our APRNs really focus on trying to demystify or sort of like debunk the BMI system, right? So if we like, again, I'm not going to go into too much of the history, right? But BMI was not, created to be used as the tool that it is used today for all of us in the medical field, right? It was meant to be a measure for white men in a large group. So it doesn't really correlate to somebody's health. So we really try to like find that education, but also like align with pediatricians to help them understand how sometimes that approach can be detrimental for a kiddo. And if someone's always been in the 95th percentile, right, for their growth charts, our goal would want to get them back on that curve. And generally speaking, when we work with pediatricians, they're aligned with that. But yes, like how do we make sure that those conversations aren't happening with kids when they're really young, trying to sort of shift a kid's place on the growth chart can be a challenge. We work with a lot of CCMC is a huge ally of ours. Connecticut Children's Medical Center. They have adolescent medicine, which is a specialty program, and all of their doctors work with most of our adolescents. We'll either refer or we'll get the referral from them, but they work and focus on eating disorders specifically. So trying to help bridge that gap with the primary care pediatrician and adolescent medicine is huge too. But yeah, it's a delicate line for sure, Denise. And there's a lot of providers out there. And, I think some providers are really educated on not focusing so much on weight as an indicator of somebody's health, right? Like if somebody has sort of a medical condition, focusing more on ways that would help address the medical condition, not necessarily focusing it on, well, if you lose weight, this thing won't be a problem anymore, because oftentimes that for some of our clients can be a dangerous way to then get to that place. So,
Sure. Yeah, no. Excellent. Thank you so much.
yeah, of course. Thanks for the question.
Thank you. And as Brooke mentioned, we are here as resources as well. If you have any questions, Jade, please share our contact information. We are always here to help, guide, give a referral source,
Yeah.
connect people with care. That is, again, our top priority is getting people into treatment and into treatment early. So we are here. So please feel free to reach out to us with any questions that you may have further down the line, or anything like that we can assist with.
Yeah. I know we're at time, but does anyone have any other questions? I want to make sure.
Mallory, do you want to say your question?
Yes, thank you. Sorry, I have two kids in the shower trying to multitask.
Totally fine.
So I just wanted to ask if, I guess, what your experience, or have you guys encountered children with ADHD and eating disorders? Because they're both very, like, I have a general understanding, and that's kind of where I feel like a lot of kids are, and a lot of kids I feel like are getting the diagnosis of ADHD or ADD early on, and maybe starting medication, maybe not until later. And I have a kiddo that I am kind of concerned about with an eating disorder, so I'm like very intrigued with this. So I'm kind of came at the best time. But I just didn't know if there's any correlation, or if you guys have seen anything with the ADHD medication kind of changing that aspect for eating.
Yeah, so I didn't keep this slide in because there's just too many slides, and I was trying to be thoughtful, like what people on this call would want. But we do have a slide that talks about co-occurring conditions, and ADHD is one of them on there, right? So you got depression, anxiety, a lot of PTSD, and then ADHD is the other really big one. So for a lot of reasons, we see a lot of clients that have that diagnosis and then also have an eating disorder diagnosis. And absolutely, right? Medications oftentimes that help treat ADHD tend to be stimulant medications. And if anyone's familiar on this call with stimulant medications, they often decrease someone's appetite. So people lose weight, right? And it could impact somebody tremendously with an eating disorder. So if they're in our treatment and we're trying to navigate that, or that's something that's of a concern, our number one thing, as long as we would explore with the family and they would have to feel comfortable, is talking about other options for ADHD medications. While I recognize stimulant medications tend to be the most effective, we do have clients who are able to sort of be on other medications to help with that, or like find ways of like utilizing that when you need to for like purposes of school, and then not taking it on other days, like finding ways so that it's not like eating before you take the medication, like finding ways to help kind of challenge that. But it absolutely comes up. And even when they're not on that medication, there is a lot of co-occurring that happens with ADHD and other neurodivergent disorders. Yeah.
Thank you.
Yeah, of course. Yeah. Great question. Well, I know Dave already said this, but Jade and Claudia, please share our information. So if people have other questions that you want to just ask us offline, you're more than welcome to. Please share, our information with everyone.
Thank you so much, Brooke and David, for participating and being so open and sharing all of your amazing knowledge and information with us today, and then also with the high schoolers on Monday as well. I do want to note that for our time, that if there is any other questions, please feel free to email me or Brooke or David directly. Also, if you go onto our resource page under the eating disorder tab, Monte Nido Walden is up there, as well as a bunch of other resources that were also talked about. So basically everything on these additional resources are on that website as well. So if you need anything, you can always go there. And thank you so much for coming. Claudia, did you want to say something?
No, I just wanted to reiterate how thankful we are that you took the time to do this with our high school
Oh
you
my
know,
God,
with
of
our
course.
community.
It's our pleasure.
Appreciate it.
It was our
Really,
pleasure. It was really fun. It was
Yeah,
really
It
fun.
was.
They
It
were
was
great.
very fun.
Yeah.
that's great.
Well, thank you
Thanks so
so
much.
much, and I hope everybody has a good rest of their evening.
Yes, and happy holidays, everyone.
Yep,
Oh,
and
yes,
happy
thanks.
holidays.
You
Yes.
too.
Take care.
Bye.
Bye.
Thank
so much.
you.
Have a good night.